Good afternoon. In this video, I will demonstrate how to assign providers to any treatment modality in your treatment plan. Starting with this release, we are identifying the provider of service for each modality, defaulting to the treating clinician who is logged in. To show you, let's click on our patient, Franz Heiden. We'll click on our incident and let's create a new visit. And let's say we have a neck pain symptom on the right side, intensity of 7 and 90% of awake time. We'll ignore the OPQ-RST. For our purposes, we don't need it. And then let's define what is wrong with the patient. So we identified a couple of spinal segments that were restricted. We also did a visual assessment of range of motion, and we determined that the cervical flexion and extension were abnormal. Finally, we identified a couple of trigger points, and we'll document them right here. Then we click on Assessment to trigger our auto assessment. We click on ICD-10 Diagnoses. I have auto diagnosis turned off, so I trigger it manually by clicking on that. And now we'll get to the treatment plan, which is where I can show you how to assign the providers. So first of all, let's define our adjustment. We confirm that we did an adjustment for C1 and C2. We'll say that we did the 98940 adjustment CPT code. We used the activator method. And we also did a massage. And for that, we bring in the trigger points. And we did the massage for about 20 minutes. And finally, we also did a therapeutic exercise. And for that, we bring in the range of motion findings that was visually assessed. And we did this for 8 minutes. So these are the three treatments that were provided by your clinic. Now, everything defaults to the treating clinician. But in this case, we used Serenity Touch as the massage provider. So what we do is we click on the respective button, we right-click on it, and we click on Change Provider. Now we see the list of providers that we defined previously. We'll click on Serenity Touch, Save to Visit, and that's it. We'll trigger the treatment plan and goals, and we save the visit. And then let's look at our SOAP and confirm that we, in fact, changed the provider for the massage treatment. All right, so let's go into print preview mode. And let's take a look at the bottom here. We see spinal adjustments was provided by Dr. Ashkenazi, default. Then for the next treatment, we have massage therapy that was specifically set to Serenity Touch, and that's how it's printed out. And also therapeutic exercise. Again, we didn't do anything specific for this. It just defaults to Dr. Ashkenazi, who's the treating clinician. I hope this was helpful and you enjoyed viewing this, and I will talk to you soon.